Okay, so we are about 5 hours from leaving the hospital in Park City, and it's been really interesting. I've actually am impressed that I don't feel anything at all, with the exception of this 100-pound brick. That basically, I feel it like a brick. I'm clear. I'm not drowsy. I'm not tired. I'm a little bored, truthfully honest with you, because I can't really do much. There was a concern about, apparently, when you have anesthesia, that you have a problem using the restroom, urination, whatnot, and that they even sometimes, if you have a case where you can't, you have to go to emergency and they have to drain you. Not my problem. Everything's been great. Drinking a lot of liquids and haven't taken any pain medicine. The procedure that I did have, it basically prior to actually doing the knee surgery, is they gave me something. See if I can locate the paperwork without moving. Nope, doesn't look like it's going to happen. But they gave me a shot close to my groin area, and what it did is it basically started to numb the nerve that connects to the knee. Once they were done with that, they went in and took a very long needle, and then once they went in, they started tapping, and I was actually halfway awake, and the idea was if I felt anything, then basically I would twitch like I got hit or something like that. I will be honest with you, from the time when I was talking about, I don't know what I was talking about, I blinked my eyes, I woke up, my entire surgery was done, hour and 15 minutes later. They wheeled me off back to the room. Some of the videos that you'll see that I have been posting, post-op and pre-op, basically kind of show my experience and what I've been through and how I was feeling. But I feel great. At 12 o'clock tonight might be another story because this wears off in anywhere from 12 to 24 hours. So one thing they mention is you do not want to fall behind on your pain meds. Well, I did explain to them that for me, I'm not really planning on taking my pain meds. I was planning on doing something different. And, they kind of were like iffy about it. And like, you sure do what you want. But it really came down to the point where it's going to be up to me. So I'm laying down right now, as you can probably tell, my bed here. And I got the hose. And basically, that is Mr. Iceman. Yep, Mr. Iceman. And Mr. Iceman basically has a little control nozzle right here. Turns it up. See if I can. There you go. Turns it up and down. But if you flip it over, sideways, it actually has a temperature gauge. And basically, it's about 33 degrees right now, and you can't pass it around about 50 degrees. Once it hits 50, it's probably more likely time to change the ice. So we just changed it, and it's feeling cooler, and it feels really good. It's about 90 degrees outside, no air conditioning inside, so it is kind of hot in here, and that possibly the reason why the ice didn't last about 7 hours is pretty much what they said. But all in all, I'm feeling good, and hopefully that's going to continue on. I have had a little small inclination of pain when I did have to step off to go ahead and use the restroom. Of course, that's 100% perfectly normal and always to be expected. And one of the things that I know coming into this, I'm going to experience a lot of pain. And it's something that shouldn't, be a shock to me because it was a, significant surgery. So for me to think like it's not going to happen, I'm only kidding myself. So I'm expecting that. So in lieu of that, what I am going to do is I am going to take the medicine I talked about. It is, Christopher's Complete Tissue and Bone. And what this is designed to do is actually was investigating before I decided to go ahead and do the surgery. I was trying to find an alternative method of healing so I would not have to do this. And after talking with one of the naturalists there, this was a recommendation. They said, you know what, you can be a case study of ours if you like. And I'm like, oh, that's interesting, because I was possibly going to be a case study on this knee surgery thing. So I said, yeah, let's go ahead and give it a try. And so basically, it is designed to start my healing process ASAP. And so I am going to take these. In fact, I'll be taking them in probably, actually, hold on a second, give me 1 minute. And taking them right now. So basically I have, see if I can do this here, 5 pills. And I'm going to be taking about 5 pills every 2 hours till I get to about 25. I haven't really eaten anything all day, just a little bit of small chili, nothing really, not super hungry, just kind of taking it easy to make sure when I do come off I'm not going to want to throw everything up. And so I'll take these 5 pills, and then if need be, I can actually have the pain meds as well if it needs to be mixed. What these pills are designed to do is actually do something very similar to the nerve shot. It's actually designed to bring more blood flow and also be able to start regenerating, everything that's happened so far. So again, you guys will know as well as I do how well this actually works. And I'm going to continue on in surgery until they're all done. And if I need to go buy some more, I'll go get some more of it. I got enough supply for I think about 5 or 6 days. 25 a day was at 150. So that pretty much is about 6 days, I guess. Yeah, about 6 days. And I have, let's see. So actually, I'm going to have about 8 days here. So that's probably just about perfect, because I am planning on returning to work around that time. And obviously I need to be up in shape and be able to do that, but that is my goal. So wish me luck, and I will talk to you guys soon. One thing I do want to tell you before I do cut you off. I received medication. Fun different medication. I don't know if you can see the name of those or anything like that. When you take pain meds, guys, if you haven't done it a lot in your life and whatnot, and you take a lot of it, it actually has a tendency to back you up. Yay, exciting. One of the wonderful effects of, feeling better, you get messed up in another part. Another reason why I want to do things most natural that I possibly can. Let the human body take over what it's designed to do. So I have that one, which is, I believe, let's see if we got it here. It is the Percocets. Yes, I think that's what those are. Those are Percocets. And then these are, what is it called? I'm trying to read the name backwards. But basically, this is medicine called ondansetron, or let me see. Yeah, pretty much. Ondansetron. And what that's designed to do, help me not throw up. Woo, exciting. So looking forward to that. Apparently when the anesthesia runs off, you want to throw up. So again, while I'm kind of watching what I'm eating, keeping a lot of liquids, filtering out as much as I possibly can, and also, hoping for the best. So it's going to hit me about 12 o'clock at night, starting possibly, and it can go all the way up to 24 hours when the shot does wear off. So I am getting prepared for that right now as we speak. And, and this medicine, my personal opinion, you do what you think you're supposed to do. I don't recommend anything, definitely not a doctor. I do have a cousin who is a physician, and he's given me certain recommendations when I do have a surgery, what to expect and whatnot. And unfortunately, medication just sometimes does make it a little bit more difficult. So if you do have ways of finding something through natural ingredients and different stuff like that, I think I would highly recommend it. So, seek your, I guess you would say, your herbalist, maybe somebody to the point that does have access to different products that not necessarily FDA approved, but something that has been proven and documented cases, because obviously you don't want to be a guinea pig. There's been 5 people before me with a similar situation. They didn't get a lot of information on it because people just didn't follow up, but I'm actually following up with the person who has given me the ability to be able to recommend these, basically, the one who's recommended me. And so I'm going to continue following up and communicating back and forth. I already have an appointment set for next Monday to go back to Park City to go ahead and speak with Dr. Cooley, my physician, who did the knee surgery. And thereon, who knows, hopefully I won't have to take anything else and I should be good to go. But that's when also my physical therapy is going to really kick in a lot. So, and currently at physical therapy, the first day, what you're required to do is this little one exercise. I'll show it to you. And what you're supposed to do, just basically they're ankle stretches. And what you're doing is I would probably say 2 minutes, you need to do 5 of these. And you want to do them as long as you're awake. Reason is because you want to go ahead and you want to make sure the blood is circulating so there's no blood clotting. And so I haven't been doing as well as I probably should, but I'm getting better. And actually, you're supposed to do both feet. You can either alternate or you can do it at the same time. So basically, whatever works for you. But the bottom line is you definitely have to make sure that you are circulating, because it can clot. I mean, it's just part of the things that possibly could happen. And obviously, if that happens, then other problems and so on and so forth. So, trying to be as, I guess you could say, dot the I's and cross the T's as much as I possibly can, because I do want to definitely be a good candidate that with the surgery that does have good results. So, all right, well, taking the pills. There you go. Down the hatch. So that's the first ones. In 2 hours more, I'll take some more, and we'll go from there. I'm feeling good. Still a little pain in the back where they expected it to be, but above and beyond that, you guys got any questions or comments? Please let me know. Thank you.